For this session, we will start with poisoning and heat and cold related illnesses. The objective for this session, we will define the health related illnesses, determine what to look for, and when to call the emergency medical services, and what to do until they arrive when caring for a patient with health related illnesses, and also for poisoning to determine what to look for and when to call the emergency medical services until they are arrived, especially for bites and scorpion bites and snake bites. The heat-related illnesses, it is a condition caused by overexposure to heat and loss of fluid and electrolyte. It is divided to three categories. It is the simplest one, which is the heat cramp. Then we have the heat exhaustion and heat stroke. In the heat cramp, it is a minor condition. There will be painful muscular spasm, usually occur in the legs and abdominal muscle. Think of them as a warning, possible sign for heat-related illness. So it is the first stage of heat-related illnesses. It can be, in this case, what we can do, we have to move the victim to a cool place to take rest. It is necessary to give him electrolyte and carbohydrate containing fluid. For that drink, it will help him in regaining the amount of fluid that he lost due to the exhaustion or due to the work that he is doing. Light stretching of the muscle and massage, gentle massage of the muscular area that has spasm, also it will help. And watch the person for further signal of heat-related illnesses. The most important thing in order to prevent the heat-related illnesses is not to expose yourself to the sunlight or to have exhausted work, especially at the midday, and to drink plenty of fluid that containing minerals. In order, because we are losing an electrolyte with the sweating that comes from us. In the second form which is more in severity, which is the heat exhaustion. It is more severe condition than heat cramps, often affect athletic and firemen, those who are working in construction, especially outside, and factory workers who are working hardly. It is also affect those who are wearing heavy clothes in a hot and humidity climate. What to look for? We have to look for cool, moist, pale skin. This is the signs and symptom. Ashy or flushed skin, headache, nausea, dizziness, weakness, and exhaustion. What to do in this case? Move the person to a cooler environment with a circulating air. Loosen and remove much clothes as possible. Apply cool, wet clothes. Spraying the person with water. Position the client or the patient to side to open the airway if there is difficulty in breathing. Keep the person lying and continue cooling of the body. Heat stroke is the most severe heat-related illness. Occur when people ignore the signal for heat exhaustion. Develop when the body system are overwhelmed by heat and begin to stop function. It is serious medical emergency. What to do until help arrived? Rapid cool the body by immersing the person up to his neck with a cold water if it is possible, sponging or spraying the person with cold water, and apply cooling method for 20 minutes. Give care according to the condition of the client until they are arriving, until the help are arriving. What to look for? Extremely high body temperature, red skin either dry or moist, change in the consciousness level, rapid weak pulse, rapid shallow breathing, confusion, vomiting, and sometimes it will reach to seizure, which is convulsion. About poisoning, the definition of poisoning is a substance that causes injury or illness. It is when it gets inside our body. So, a poisonous material, that substance that causes injury or illness when we are getting it inside our body. Some poisons can cause death, might be fatal. How the poisonous material can enter our body? It can enter our body by either ingestion, swallowing it, with the food, with our breathing, inhaling it, absorbing through the skin, having injection into the body. So, ingestion, it can be by the food that we are taking, by the fluid that we are drinking. So, and the most important thing that to have the household detergent away from the children, because mostly it happened with the household detergent and it happened also with the drugs. So we have to keep the drugs and the detergent away from, liquid detergent away from the children. In inhalation, it can be through the carbon monoxide and carbon dioxide from the car exhaust, from the stoves at home. Also, absorption, it can be from pesticides that we are using it in the gardens with agriculture, or it can be injection by bites of animal, by stings of scorpion and those. In 1998, more than 92% of all poisons took place at home, involved children under the age of 6 years. So mostly children are more exposed to poison. Poisoning death in children under the age of 5 have dropped in the last 30 years, but poisoning death among adults 18 years and over greatly increased. Why in small children it is dropped? Because those drugs company, they change the drugs which contain the bottles that contain the drugs, that it is not easy to open it. The decrease in children poisoning is a result of banking of drugs, as we said, and medication that make these substances hard for children to get in and to open it. It is also a result of preventive action by parents and others who care for the children. The increase in adult poisoning, this death is linked with increased suicides and increase in the drug abuse. Swollen poisoning, foods such as certain mushroom, shellfish, alcohol, medications such as aspirin, household and garden items such as cleaning product, pesticide, and certain plants. Many substances not poisonous in a small amount, but they are poisonous if we are taking it in a large amount, especially from plant origin. So misusing and abusing of certain drugs, also sleeping pills, tranquilizer, and alcohol is poisonous. We have to concentrate on the pills because pills, it has a coat of sugar, and the look nice for small kids, so it should be kept away from the children. So when they put it inside their mouth, they will feel that the sweetie part of the coat. But when they reach in the inside, so they will swallow it after that. Combination of certain substances such as drugs and alcohol also might be poisonous. The problem at home also, some of the ladies, they are combining or mixing the detergent or the cleaning items together. This will produce a chemical reaction and produce sometimes gases, poisonous gases that can be chlorine found in swimming pools, chlorine also which is used at home for cleaning purposes, forms from household product, glues, paint, cleaners, or cleansers. All of those are containing some evaporated parts that might lead to poisoning. Forms from drugs, the cocaine, absorbed poisonous enter the body through the skin from plants such as poisonous ivy, poisonous ox, and poisonous sumac. From fertilizer and pesticides used in the garden and for plant care. Injection poisonous enter the body through bites or stings of insects, spider, ticks, some marine life, snakes, other animals, and it can be through also injection by drugs and medication. Those are some of the poisonous plants. We might know their names and we might not, but we have to be familiar with the shape, with the how it's looked. So, and it might have a different names in a different country. How will you know if someone who is ill has been poisoned? So when we found somebody is having some problems, sudden illness, in this case we have to look for clues. What's happened to them? So try to get information either from the victim himself or from the bystander who is beside him or living with him. Also, if you suspected that the victim is conducting or caused by, if it is caused by poisonous, we have to call for poisoning control center or emergency line and follow their direction. If the victim becomes violent or threatening related to safety, and we have to wait for the medical services to arrive. As you check the scenes Be aware of any unusual odors and flame, smoke, open spilled containers. Signal for poisoning. Usually those who are having poisoning, they are having vomiting, nausea, vomiting, diarrhea, and abdominal pain, trouble with the breathing, sweating, change in consciousness, and sometimes they might have fits or seizures. Burn around their lips and tongue when it is ingested poisonous, or based on any information we can know according to the information that we gain from the victim or bystanders. If you suspect someone has swallowed poisoning, try to find out what type of poisonous it was, how much was taken, and when it was taken, how much the victim weighed, in order to see the possible effect for it on the client. Care of poisonous victim. Check the scenes and make sure that it is safe to approach and gather clues about what's happened. Remove the victim from the source of poisonous if necessary. Check the victim level of consciousness, ability to breathe, and the signs of circulation. Care of any life-threatening condition according to the assessment that you did. If the victim is conscious, ask a question to get more information. Look for any container and take them with you to the telephone in order to call the center for emergency and give them what type of drug or what type of poisonous that he take, and follow their direction. Do not give the victim anything to eat or drink unless medical professionals tell you to do that. If you don't know what type of the poisonous material that the victim is taking, and if the patient vomit, save that vomit with you because it might be useful for checking out the type of poisons. When someone breathes toxic foam, the victim's skin may turn pale or ashy due to lack of oxygen. Get the victim to inhale the poisonous to a fresh air as early as possible. Poison from a wet chemicals. Flash someone else to call for help. Keep flashing the area until the emergency medical services personnel arrive. If it is a dry chemical, we have to take a brush and brush that chemical away from the body. Because if we are using water, in this case, water, it will dissolve that dry chemical and it will increase the possibility of absorption of that material through the skin. So in order to avoid that, we have to brush it away from the skin by a brush. Then after that, take care and don't get any in your eyes or the victim's eyes. So we have to wash the chemical substances, unless we said, especially if it is a liquid one. If it is dried one, we have to brush it out. If it is a stains or insects, we have to remove it we can remove the stinging part by cuts or nets. If someone stung by insect, remove the stinger, scrap away from the skin with your fingernails or a plastic card. For scorpion, they live in a dry region under the rocks. They are most active at night. Also for the spider, there are spider who has bite and can make seriously sick, and it might be fatal, like the black widow spider and the brown clor spider. Both spiders prefer dark area, out of the way of places. Bite usually occur when we put our arm in an area that's dark, or when we try to take something from a dark place. Often victim will not know what's the thing which is sting him or bite him until he starts to feel the illness or notice the bite marks. Signal for spider and bites and scorpion bite, they are similar to that of other sudden illness. The signal also include nausea, vomiting, trouble with breathing and swallowing, salivation such as much than normal, sweating, severe pain at the sting site, mark including an allergic reaction will happen to those, anaphylactic shock might happen to those patients, and it might be fatal. Care of victim bitten by spider or scorpion: wash the wound, apply cold pack to the skin, get medical help immediately, and antivenom if it is available to be given. Snake bite, we have snake bite kill many people, most occur near the home. Rattlesnakes account most of the snake bite and nearly the death of snake bites. Most deaths occur because the victim has allergic reaction to the poisonous material, to the venom, or they are having poor health, too much time to reach the hospital. So it is either due to the reaction, allergic reaction, or poor health of that person, or there are too much time between the bite and reaching the hospital. Those are type of the snakes. Care of snake bite victim: wash the wound, immobilize the injured area by splinting and bandage, keep it lower than the heart level, call emergency line, and do not apply ice to the snake bite, do not cut the wound, and do not apply tourniquet. If it is necessary, carry the victim who must be taken to medical facilities, and if you know the victim cannot get emergency medical care within 30 minutes, suctioning of the wound by using snake bite kit if it is available, but don't suck with your mouth. Domestic wild animals can cause infection and soft tissue injury. The most serious possible result is rabies. Rabies can be transmitted through the saliva of the deceased animals, such as giants, bat, raccoon, cats, dogs, cattle, fox. So animal with rabies may act strangely. Do not bite or feed the wild animal. Do not touch the body of dead animal. If not treated, rabies is fatal. So, bitten with an animal, try to get the animal away from, away from the animal without also putting yourself in danger. Don't try to stop or hold or catch the animal. If the wound is minor, wash the wound with soap and water. control any bleeding if it is there, apply antibiotic, apply dressing to the area, get medical attention. If suspected that the animal is having bite, it's better, whatever is it, it's better to take the person to the hospital or call for medical emergency services. Watch the signal of infection. Care of victim bitten with animal. If the wound is bleeding seriously, control the bleeding first. Do not clean the wound. Get the medical attention. If it is possible, try to remember what's the animal look like and the area in which you lastly saw that animal. Call for the emergency. Thank you.